Hand Therapy Secrets. I'm live on Facebook. I'm live on Instagram and on YouTube. So hopefully, I think everything is working. I can't believe it. If you're tuning in, thank you so much. If you're watching this on replay, then welcome. Thank you for watching. So yeah, my name is Huang, and I'm really excited to come on and talk to you guys today about really um, 3 ways to study to pass the CHT exam, no matter where you work. I get questions throughout the day, through the week, through the months, and I kind of, trying to put some information together that hopefully can help you, um, decide if becoming a certified hand therapist is right for you. And if it's for someone who is ready to, take the dive and go into hand therapy, I hope to inspire you, motivate you, give you some positivity in terms of what's possible for you in terms of becoming a CHT. I know that, whew, I've been a therapist for a little bit over 20 years now, and even when I started in hand therapy, it was challenging. There was not a lot of great conversations around becoming a certified hand therapist. Like there was always great conversations around being one already, right? If you were one, like, wow, kudos to you. You did it, you made it, but somehow the path to becoming one just seemed so difficult, just seemed so like uninviting. Let me know if that is yours. Leave me a comment. What is your experience um, on this road to becoming a certified hand therapist? I'd love to hear your experience. I know a lot of people feel, I don't know, maybe I have a skewed perception, but a lot of people who reach out to me tell me that it's discouraging. They don't always get the right encouragement along the way. It's not steady encouragement. So sometimes it's, I got the, yeah, you could do it, but really it's really tough and like not that many people get it. And I think that it's possible. I think it's possible for if you're an occupational therapist, if you're a physical therapist, and you have a keen interest in becoming a certified hand therapist, that there's lots and lots of different ways in which you can go about becoming one. I've had different students come from different settings, from different experiences, that eventually become certified hand therapists. So I came from various settings. I did not just come out of OT school and like boom, landed the job, landed the perfect job, stayed there for 45 years. Like that wasn't me. And I think as we continue to progress, things continue to change. Things are changing in the world. Things are changing how therapy is being delivered, how everything is being delivered, how um, how people are perceiving therapy, how people are getting jobs, how people are staying in jobs. There's a lot of changes, and it's those things that I sort of pay attention to. So I really wanted to spend a little bit of time, dispelling some myths in regards to becoming a CHE or just being eligible to sit for it. So in order for you to sit for the exam, you've got to first qualify for the exam. And there's many OTs that think that they don't even qualify to sit for the exam. So because they think they don't qualify, they just automatically give up. So if you're feeling discouraged, regardless of where you're here, if you're feeling discouraged from pursuing your dreams in hand therapy, I hope that you continue to listen, and I can feel the hesitation, right? Is it worth it? All sorts of stuff. Um, But first, in order for you to qualify, you have to have a minimum of 3 years work experience, right? As a occupational therapist or physical therapist. So I've had people ask me if they were an assistant, can they do it? Whether you're a PT assistant or OT assistant, I've had people reach out that they're massage therapists and are interested in it. You cannot qualify to sit for the exam to become a certified hand therapist, a CHT, right? Unless you are an occupational therapist or a physical therapist. And you have to have a minimum of 3 years or is like as a licensed therapist. So if you're an assistant, and I've had several assistants go through our programs and um, they had to start from the date they're an OT. 3 years later, they can sit for the exam. So if you've got hours in a hand therapy clinic and all that good stuff, if you have that, that's great. It will give you some experience, some guidance in terms of studying, but does not apply to your hours in terms of or your years in terms of how many years. So it's a straight 3 year from that period of time. In terms of hours, you need at least 4,000 hours in direct patient care. Direct patient care. So that means you have to be working with patients. So if you have a job where you do mostly administrative stuff, that doesn't count towards it. If you're doing chart reviews and they're all upper extremity cases, that doesn't count. If you're teaching like I'm teaching, and you're teaching on upper extremity stuff, that also doesn't count. Your 4,000 hours is in direct patient care. So if you need more information in regards to all the different qualifications and like the links and stuff like that, I'm gonna post it in this chat here where you can grab our checklist. All right, we have a checklist where you can go and you can grab that. I write up like a whole big thing on it, and I include links in there for you to grab the information, like at least give you some guidance and direction in terms of where that is. Hi from Brazil. Thank you for watching. So if you have any questions along the way, just go ahead and type them in the chat. You can also message me so I can get to some of your questions, right? So outside of that checklist, if you want to grab it, um, it's there for you just to give you some guidance, some links in there for you to, just let you know what those 4,000 hours are. Somebody had a question in terms of, can I explain specific requirements for the 4,000 hours? So like I said, it has to be direct patient care. So it can't be volunteer hours, it can't be admin time, it can't be teaching time, it can't be consulting time. You have to directly be evaluating and treating somebody, right? Um, in terms of your 4,000 hours, you can't use student hours, assistant hours, OT, PT assistant hours. You can't use those. But here's where I think people kind of rule themselves out, right? So when you look at the rules in terms of sitting for it, it is very general, upper extremity management. So nowhere does it say like you have to treat flexor tendons, that you have to treat post-surgical cases. Nowhere does it say that, right? So one thing I would encourage you is to be okay with the vagueness of what they say, so you can draw your own conclusions in terms of um, draw your own conclusions in terms of what those 4,000 hours entail. I know I can only speak for myself and kind of share my stories and essentially my students who are in the program, their stories. But I started out back then, it was 5 years, but I started out in skilled nursing, and then I moved into acute care. And then in acute care, I did some NICU stuff, all upper extremity related, right? So along the way, I saw people with strokes. I saw people with arthritis. I saw people with fractures, various different fractures. And they all different setting, right? Skilled nursing, rehab, acute rehab, and then in acute care. But for the most part, all of those people had some kind of upper, like hand and upper arm types of injuries that I was dealing with. Even people who I was working with in the NICU, in the ICUs where they were coming in and they were intubated for so long, and then when they woke up and when they're finally getting up, they could not even move their arms, right? These are all, like, to me, hand and upper extremity types of issues. Stroke patients, neuro, like all types of neuro patients, they all had upper extremity types of issues for me. So I had an opportunity to work with them. Oh, I worked for a long time in acute care. I would manage, we kind of rotate like so many months throughout the year, but I did a lot of cardiac patients. So a lot of those patients had the open heart surgeries, and they had their radial arteries harvested. And so there was, I had to deal with a lot of that. So there was a certain amount of wound care that we had to deal with, a certain amount of precautions with movements, not being able to use your arms, being able to move the thumb, the hand, and the wrist as it related to ADLs. But there was a lot that you can do. And I think it really goes to your perception of what you're doing and how you're going about it. So I want to encourage you that you don't have to sit in an outpatient therapy center facility next to a doctor only doing finger fractures, flexor tendon lacerations. We as occupational therapists help so many different people of different ages in lots and lots of different settings. And I think that we have an opportunity to advance our skills to help people no matter what settings. And when you learn how to help people with the different types of problems they have, you become more valuable. And you're able to help them, you're able to help them for longer. And that's how we have jobs, right? That's how we build our careers, off of the ability to be able to help people. I think that's really important to keep in mind and to think about as you consider becoming a certified hand therapist, right? So my key point here is don't rule yourself out. Don't rule yourself out. If you rule yourself out of the running, there is absolutely nobody who will rule you in, right? There's nobody who's going to rule you in and say, you do it, and be on your back like all day, every day. The only person who can rule you in is yourself. That's it, period. Because it's a certain amount hard, right? There's challenges to becoming a certified hand therapist. First of all, the easiest thing is to get your years. You just wait 3 years, boom, check, I made it. Right? The second hardest thing is getting your hours. Now, some people are like, oh, I can't get the hours. Well, guess what? You got to work towards getting those hours. Nobody's going to give that shit to you. And if you're going into a job interview, and I'm telling you as a person who's been interviewing for a while, if you're going into that job saying, I don't know how to do shit, right? Who's going to give you the job? Who is going to give you the job? You have to get paid, right? To do a job. But if you can't do it, who will pay you? So you have to go in there knowing a certain amount. And I think that people know more than they give themselves credit for. So I talk to new grads, I talk to people who've been in therapy for years, I talk to people with a lot of experience, with a little bit of experience, I talk to people who take breaks. I promise you, to a certain extent, there are more things that you know than that you don't know. And part of it is like you have to give yourself credit for and think about what you do know and how you can bring value to a place so that you can get the kind of job that you want. If again, goes back to ruling in and ruling out. This applies in therapy too, right? But if you're ruling yourself out, who is going to rule you in? Right? Who is going to rule you in? You're the only person who can rule yourself in, right? So yeah, keep that in mind as you're considering the hours and the years and stuff like that. After that, the hardest part really is the taking the exam and passing, right? The taking the exam and passing. So before we can even sit to take the exam, let's talk about what you need to do to prepare to study so that you can pass it, right? So everywhere along the way, there are steps. And if you really, really think about it, these are the same type of steps that your patients go through. They can't just like they can't come into you with like a huge hand laceration, a huge fracture, and from one day to the next, get what be done with therapy, get everything that they want, get rid of their pain, get full motion, get full strength in one day, right? So everything is a building block, and everything you know adds upon itself, right? So get the years, you get the hours, you rule yourself in, and you say, yes, I want to become a certified hand therapist, I want to study to become a certified hand therapist. It's amazing when you study how much more it really adds to your practice, like how much more you understand, how much more you understand about what you're doing, how you're able to make decisions. I talk about that all the time. How do you make decisions about what to do, what to say, how to progress somebody? And studying for the exam really allows you to become that critical thinker so that when someone comes in, you know how to think through their problem, solve it, and then give them the things that they need to do to get the results that they're paying you for, right? Somebody's paying you, right? Because you don't get a job unless somebody's coming in. That's how it works. So yeah. So I think about who do I think about when I think about all different types of setting. I have a one student. He was doing home health, he was doing skilled nursing, and he was getting a few hand and arm patients here and there at the skilled nursing, but he started studying for the exam because he was like, I just know I want to become a certified hand therapist. And he started applying for the jobs, right? But he wasn't really getting the type of job he wanted, but he was getting a few hours here and there, so he started to rack up some hours. But what he started to do is he started to study for exam, and in studying for the exam, he was able to level up his skills, show people that he was able to help them, and from that, he was able to land that job. He actually took the exam once, was unsuccessful. I think he took it twice before he came into the program. But once he came into the program, he studied. I forgot how long he studied for. He studied, and during that period that he was studying for the exam, he finally got that job. Finally got that job, full-time job in hands, in a setting he wanted. I believe it was in an outpatient setting that was all hand and post-surgical types of cases, right? So if you're in different settings, whether you're in acute care, in skilled nursing, in home health, I think there's a lot of opportunity in home health to do hands. You got to curate your cases so that you can treat patients in at the home, in the home. At my clinic, where I'm kind of coming to you live from, I get calls a lot of times to provide in-home care, and it's not something that we really do. But I think there's a lot of opportunities for that in terms of being able to go to someone's home and provide that therapy. So it's just that you have to come in knowing knowing what to do, and depending on the cases, right? And then knowing what to say, and that kind of stuff. But there's a lot of opportunities in a lot of different settings in which you can do that. But you have to want it. So that person, he wanted it. He wanted to change his setting, but he wanted to change the type of patients that he was able to help. But he took it upon himself. He ruled himself in. He ruled himself in to take the boards, right? Somebody else who like she 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 thought about it. You know, she thought about becoming a CHT. It was something that she saw and she liked, and her boss wanted her to do it, but she just wasn't sure. So she had the years, she had the hours, she was in the setting, but again, like you have to want to do that hardest step, which is to study and to pass, right? So she wasn't quite there. So I don't care if someone pays for you to take the exam, you have to still sit there and study. And if you don't want it, you've just ruled yourself out. Right? If you don't want it, you just ruled yourself out. And that, you know, it's like hard to be motivated to study. It's a lot of information, right? So it really is. It's a lot of information. So let's go into, now that you have the years, you have the hours, you know for sure you want this for yourself. You want that designation. You want to be able to treat very particular types of cases. You want to be able to eventually land that job, or maybe you already have that job, but you want to solidify your place in the world and your place in that particular setting. And here's another kicker, and this is why I always say that when you're a certified hand therapist, you can give yourself more choices. Once you become a certified hand therapist, I've had therapists lose their jobs. I mean, let's face it, different types of settings and different types of things that happen in the world. Like, listen, COVID just happened 2 years, 2 years, 2.5 years ago, and people lost their jobs. But guess who got their jobs back faster? You know, I can tell you right now, a lot of, you know, if you certified hand therapists still getting jobs, still looking. People are still looking for them. One of my friends, she was working for a doctor's office, and when that doctor's office closed, guess who got a job pretty fast? She got a job pretty fast. Maybe it wasn't the perfect job, but she got it in the setting that she wanted it, right? In hand therapy, because she was a certified hand therapist. So don't be so quick to rule yourself out if it's something that you want to pursue. So if you have the years and the hours, and the only thing you have to do to prepare for the CHT is to study in a way that's going to help you essentially pass, and no matter where you work. So get your pen and paper out, take some notes on this. If anything resonates with you, please feel free to share it with your friends, share it in different groups that can help them consider for themselves to become a certified hand therapist. So one of the things that you want to do is really chunk up the material and put it in a certain order, right? So one of the things that I do in my program, I chunk it up into topics. Hands. So I chunk all the hand stuff into hands. I chunk it into wrist types of injuries. I chunk it into tendon types of injuries. So obviously, a lot of tendons are in the hands, right? But I kind of divide like hand types of injuries versus like tendon types of injuries, because the protocols can be really different. And then because you know certain things about hands, and then you know certain things about tendons, you can merge the two information. Because at the end of the day, all hand cases, all tendon cases are hand and tendon cases, right? So I divide like flexor tendons and extensor tendons, and both have a lot of information there. So it's nice to be able to divide that up into different areas. So I do like hands and like hand fractures and that kind of stuff, and then I do wrist injuries. So wrist injuries can be like fractures, ligaments, and then tendonitis types of wrist issues. Right. So then I go into burns and wounds. So burns and wounds can also be hands, but it can be like elbows and it can be shoulders and stuff like that. But really, at the end of the day, a wound is a wound is a wound. And I got a lot of my wound care experience actually in a wound care unit, in a burn unit, and I got a lot of it in acute care, a lot of in acute care. So if you have some experience with that, then it can really help you to dive into hands as well. So then in the realm of hand therapy, it can become a lot more specific if you're studying. Like for example, man, I used to do a lot of like heel wounds, sacral wounds, all types of wounds in acute care, right? But then in hand therapy, you have to really learn about flaps and grafts, and it might be like small ones due to amputations and things like that. So when you're studying, when you know a big general broad topic, then when you study, then you like chipping away into the layers as it gets like denser and denser and denser and more specific. But that's how you can like really chunk up the material and put it in a certain way. And then I do elbows. So like elbow fractures, elbow dislocations, tendonitis types of stuff. Then I do shoulders, and then I do nerves. And nerves is a really huge topic. There's compressions, and then there's lacerations, and then of course, when you kind of like chunk up that information, as you learn all those things, you can then merge all that information, because really, if you think about it, nerves affects the hands, and then you have to know how to treat it, but understanding that it might be more, the injury was more proximal, but the problem that you're helping somebody with is more distal. So essentially, that's what I do to chunk up the information, and then I put it in a certain order. Now, your order might be different from my order, but here's the second part, and that can help you put it in a particular order as you're starting out to study. Determine what you're good at and what you're not good at, so you can create this plan. So, for example, no matter what setting you're working in, you can start with what you know in that particular setting. So, for example, I've had people come to me that work in a doctor's office. So everyone thinks like, oh my God, that's like the best like scenario. You're doing all this hand therapy and you're working right next to the surgeon, right? So there's advantages and then there's disadvantages to that. So the advantage of that is that you are seeing certain cases, and you're seeing maybe a lot of surgical cases, right? Which for that's like a gold mine for a hand therapist who just loves post-surgical cases. Believe it or not, there are some hand therapists who love more non-surgical cases. Not everyone loves surgical cases, but when you're a certified hand therapist, you can kind of pick and choose a little bit more, a little bit about where you want to put your focus as well. So, in a doctor's office, the advantage of is seeing a lot of those surgical types of cases, right? But here's the disadvantage: you're not thinking for yourself for the most part. You're being told what to do all the time. So, in a way, when you study, you have to think about how do you become that critical thinker, problem solver, and decision maker. Because somewhere along the way, they took away the decision making. They're like, this is what happened. This is surgery I did. And so you might know different various surgical cases, but your disadvantage is that you didn't necessarily think through like all the clinical testing, all the clinical trials and errors, and then what led to that particular type of surgery, right? So you only know it from that surgery point to what you're doing as a therapist, which is good. It's not a bad thing. I'm just saying that there's always, in most cases, there's a advantage and a disadvantage. Also, an advantage is, oh my God, I see tons of hand and wrist cases. Disadvantage, I don't really see a ton of shoulder cases, right? So if you're working with somebody who does a lot more hand cases, a lot more wrist cases, but you don't see a ton of elbow cases, and you're going to be studying on that shoulder stuff. You're going to be studying on these big nerve types of cases, right? So that's okay. You just have to understand and know and determine like what you're good at, what your experience is, so that you can create a plan and study. So my students who maybe don't have as much shoulder cases or practice, they really need to study that. On the flip side, I've had PTs come in to this program, and they know tons of shoulders and elbows, but they themselves don't get these hand cases. They themselves don't get these flexor tendons, these extensor tendons, and the more complex wrist cases. So then on the flip side, they have to learn more, and they don't do splinting, let's say. So then they have to focus on that. So determining what you're good at and what you're not good at helps you to create your plan, right? And it can help you create your, the way you chunk up your material and in which order you're putting things in. So that's number two, right? And let me give you one more example. So if you are working in a skilled nursing facility or an acute care types of setting, your biggest advantage is knowing how to work with people in the like your non-typical setting or in your non-typical patients, because there are some neuro cases you have to know how to work, to a certain extent with strokes. um, and you have the ability to kind of like think outside of the box, right? You have the ability to, you're dealing with maybe a lot more non-surgical cases. So those are some of your advantages, but your biggest disadvantage is being very limited to certain types of cases. So you have to be more open-minded. You have to be more like, I want to pull these type of cases, and how do I think through the case no matter what that case is. All right? So for someone who's in a skilled nursing facility, how do you start studying in a way um, that will then give you the advantages of applying for jobs that will give you the in to get these kind of cases, right? So that you can eventually sit for the exam. So if you're somebody who's doing like per diem, doing half your time here, half your time there, just make sure you're getting into a place where you can get some of the hours and you get some of the experience. And you don't have to be like, you don't have to be necessarily the best or have a ton of experience working in certain particular cases. You just have to know how to critically think through those type of cases, right? So if you're in a skilled nursing facility or in acute care, you might be dealing with more of them when they're early on, right? They had the total shoulder replacement, they've had the shoulder fractures, they've had the strokes, they've had like major, I worked in acute care. I had people with lots of different types of arm accidents. Um, oh man, I had this one guy, he had necrotizing fasciitis on his arm, and they had to do this huge graft all over, and he was still in the hospital. I've had infection cases. I've had terrible elbow fractures, distal radius fractures that had to stay in the hospital for several days just because of due to different types of complications. So you have the ability, you're just not seeing them through to the end. So it's just the, how do you say it, the phase of when they come to you. So in acute care, you're seeing them really early, all the way through outpatient, you're seeing them kind of towards the late, like as they're getting a little bit better, and then you can take them all the way home, right? But there's advantages and disadvantages in all different scenarios, but you have to really be able to get those hours, and the more experience you have, the better it will help you to study for the exam. Now, knowing the third one, okay, so the first one is chunking up the material and putting it in a particular type of order. Number two is determining what you're good at, what you're not good at, so you can help create your plan. I gave tons of examples on that. And the third is knowing where to place your focus based on what you know and where you have the most experience. So tying all that up, if you have a lot of experience in hands, then how do you gain some experience in shoulders? I can tell you right now, just about every hand and wrist case can become like a typical shoulder case. So you have patients, you have opportunities to like really work with people so that you can get that experience. It doesn't have to be like, so specific to what you're studying. You just have to be able to critically think through and problem solve through that case. There's plenty of cases. I mean, I've been very fortunate in my career. When you work long enough, you'll eventually get to see, and of course, depending on the setting, you'll get to see a lot of different types of cases, but I've seen my fair share of nerve cases, nerve lacerations throughout the arm, from the shoulder all the way down. I've seen terrible amputations from the hospital bedside to in the outpatient setting. I've seen all various types of multiple tendon lacerations, saw injuries, but also very little, swan neck types of injuries. Um, but no matter where it is, just know where you need to put your focus, right? And that's the hardest thing. If you don't have the experience, where do you get some of that experience? If you don't have the experience, where do you go to get some of the experience? So the way I see it is you get some of the experience by getting some stories, right? Getting some stories of other people working in them. So I have plenty of stories. That's what I usually do when I'm teaching. I share certain stories of certain patients so that it helps my students, if they don't have this type of injury, help to problem solve through and think. So if you have stories, you want to try to get more of those stories and kind of piece it together with what you're studying, so it helps you, so that you don't have to sit there and memorize it. I'm a really big person when it comes to studying in a way that helps you understand concepts, so that you don't have to sit there and memorize everything. But when you understand concepts, you're actually able to take the information you learn and apply it to the patients that come into your clinic. And that is the whole point of becoming a certified hand therapist, right? We want to become certified hand therapists. I hope you want to become certified hand therapist so that you can help your patients get like the best possible results. Just learned about intrinsic and extrinsic muscles and kinesiology. Awesome. Good for you. It's a very important concept to understand. Intrinsic and extrinsic muscles play a really key role in why the hand works and why it doesn't work. And in the hand exam, there's a lot that you have to consider. And that's so true when patients actually come to you in the clinic as well. You have to be able to differentiate where is the problem so you can know how to fix it. Outside of knowing how to fix it, you have to know how to explain it to your patients in a way that they understand. Because when they understand coming from you, they'll trust you, they'll know you know what you're doing, right? And when they trust you and they know you know what you're doing, they're going to come back time and time again. We're living in a world, I'm telling y'all people, living in a world where a lot of people go on YouTube finding shit, doing some stuff. So you cannot come out with information that they already know. You have 3 bones in your fingers. I know that. I saw a picture on Pinterest. You have to like take that information and break it down and apply it to what is their particular problem and how you fix it. And that is how you pass the CHT exam. It's through applied knowledge. So first of all, you have to know some stuff. You have to know, a certain amount of information, and then you take that information, you process it through your brain, and on the other side, you apply it. And that's how you essentially pass, or that's essentially how you study to pass CHT exam. So those essentially are the 3 ways in which to study so that you can pass no matter where you work. But you still have to get your years, you still have to get your hours, right? So if you're ruling yourself in, then you can grab more information about the hand exam. You can grab it either if you're just starting out. You might want to grab the checklist, see if you qualify, see when you might qualify. That's got lots of information in there for you. But if you're ready to rule yourself in, you want to become a certified hand therapist, and you want to have more choices in your career, feel free to grab details about the hand exam prep program. We're gearing down. I got 2 more calls this week. I've got a call today on nerves and the next call on nerves. I saved nerves for the last because for everyone taking the exam in May, nerves I find have the most amount of memorization, and then the most, like, you have to apply a lot of that information into like the whole arm. So you have to know it as it pertains to the hands, the wrists, the elbows, the shoulder, and it's a lot of information. So, but it's fun. It's good. There's so many people with nerve laceration, so many people with compressive types of injuries that we can really help them with. So we're gearing down on our hand exam prep program, and people are gearing up to take the exam in May. So I'm really excited for everyone who's taking it in May. If you're taking it in May, leave me a comment. Tell me you're taking it. Tell me what's going on. Tell me how you're feeling. I want to know. Are you ready? So outside of knowing how to answer those questions, you got to have a certain mindset, right? And that comes down to anything. If you ruling in and ruling out is a mindset issue. It's a mindset issue. You're ruling yourself out without giving yourself a chance just because someone fucking said at some point in your life that becoming a certified hand therapist was hard and that you have to do this and this. Go look up the information for yourself. Go look it up for yourself and find out. And if you really want it and it's something you want in terms of where you want to go in your career, then rule yourself and give yourself a chance. Why not? What credentials do you have for that? What credentials to become a certified hand therapist? You have to be an occupational therapist or a physical therapist to sit and become a certified hand therapist. So I covered that a lot in the beginning of the call. But if you're kind of new to the hand therapy world, grab the checklist. I'll include the link at some point, but you can go to the website handtherapysecrets.com and you can grab the checklist, and it's going to just give you some general guidelines, some more specific in terms of what it requires for you to become a certified hand therapist. And I include links in there for you and books and what you need to use to study and all that good stuff, right? But if you have your years, you have your hours, and you're ruling yourself in, you're like, I want to become a certified hand therapist, but you're kind of feeling stuck with time, you're kind of feeling stuck with the reading. I can tell you that's been the biggest thing this time around is the amount of reading. People, it's really thick information, it's really thick reading. So and it's hard reading when you don't have the time. So a lot of people in my program, in the hand exam prep program, are really grateful for all the videos that we have in there. We have over like 200 videos. I swear, it's a video heavy program, so that it cuts out all the amount of reading, because sometimes you can read stuff, but if you're reading but you don't understand it, your mind just turns blank, right? Like that used to happen to me. People ask me why I created this program. I creating this program because it was something that I didn't have. I wasted so much time just sitting reading, but then at the end of like the whole chapter, I'm like, I don't even know what I read. I can't remember. So yeah, so it really just helps them stay focused, stay on task with like all the topics that they have to go through. So and then it fills in the gaps wherever they're lacking some expertise and some lacking some experience. I just share a ton of stories, a ton of experiences, and how to really think through. But if you're ready to dive into studying for the November exam, grab the details. I'll include the link. Grab the details of the hand exam prep program and see if it's right for you, and if it's something that you are interested in learning more about. So I hope this helped you. 3 ways to study for the CHT exam, no matter what setting you're in. And I hope to come on live and just be able to answer some more questions. Oh, sorry, forgot one question. Do you need to master splinting skills, right? So if you want to sit for the exam, do you need to master the skill of creating custom fitted orthoses? The answer is no. You don't have to master splinting like dynamic splinting. Nowhere in there does it say, show me how to do this. But what you do need to understand, and this is where it is more of applied knowledge than it is of demonstrating what you need to do, is that um, you have to know when and why you're doing what you're doing, right? So the questions are going to be applied around, why are you doing what you're doing? Which one would you pick? What type of splint would you pick? And there's usually one best answer, right? And the how to is you don't have to master it like creating it, but you need to know how to make it, but in written word. For example, if they're giving you a scenario on how you would make a dorsal block splint for a flexor tendon, for example, and what position would it be in? So then they'll give you dimensions, and so you have to be able to just know and pick and choose the right answer. But you don't have to master the actual act of making a splint. And I think when it comes to becoming a certified hand therapist, you aren't necessarily a master of everything. You don't have to know everything, but you have to have certain skills. For sure, you have to have certain skills. Um, you have to have the ability to develop more skills. And I think that that tells more about somebody who wants to become a certified hand therapist, is that you have the ability to develop those skills. And what a certified hand therapist, has the ability to do is to critically think through a particular problem. And that's what they want to find out. And that's what they're testing you on, is to find out if you have those critical thinking abilities and if you are able to make decisions, right? And at the end of the day, having the 3-letter designation behind your OT, PT, whatever, is essentially a marketing tool so that you can market yourself as an expert. Just because you have the CHT designation doesn't necessarily mean that, oh, all of a sudden I stop learning, I stop becoming an expert, and like from one day to the next, I am the expert. It just, you get that designation so that you continue becoming the expert and developing your skills. Like coming out of 3 years, you're not gonna, and you pass the CHT exam, you're not gonna just know everything. You're going to have so much more time to learn and develop your skills. But it is a test that tests your thinking ability. It's just like if you go and become a certified manual therapist, if you go and become a certified orthopedic therapist, it is a certain amount of studying, so you have a certain amount of know-how to critically think through, and then you continue to build off of the foundational skills that you have and just keep going, right? But becoming a certified hand therapist definitely by far is a marketing tool, so that you can market yourself better, so that you can say, hey, I have the ability to work in a very particular setting. I have the ability to work with a very particular types of cases. And I have the ability to critically think through and, make decisions on what happens with X, Y, and Z, right? So you can have the designation of CHT, and if you're not building your skills to be able to treat certain cases, you won't be able to treat those cases, right? But will you have a better chance of getting them? Yeah, you'll have a better chance of getting them than if you didn't have it, right? But it's, the hard work is definitely worth it. It's on the other side of anything you want is it's some effort and hard work, because if it was easy, everybody'd do it, right? Yeah, you have to build off of your skills. So I hope that really helps you. If you have any questions about the hand exam prep program, then please let me know. I'm happy to share the details of it. And I'll tell you more about it next time. But send me a message if you have some questions about it. And of course, I'll share the link. I shared the link here on Facebook and on YouTube, but on Instagram, I have to share it in a few minutes. All right. Thank you very much for tuning in. If you are watching this recorded, please let me know if you have any questions, if you have any comments. And if this helped you at all, please feel free to share it with your friends, share it in different groups, and let me know how I can help you. All right, I will talk to you guys soon. Thank you. Bye. Let me see how oh, shoot, hold on. Let me see how I end this.